Hi, how are you? My name is Kelly. Like you said, I'm the head coder here at Wowza Billing. I am a certified professional coder. Um, I've been coding for what feels like forever, but really about 15 years. I've got experience in emergency department and then lots of urgent care experience now. So um, we're constantly learning new things. So let's get started. What do we need to know about ICD-10? I'm sure that's why everyone is here. So, number one, it's coming. It's actually going to happen. I was kind of surprised. I kept expecting it to be delayed again, but this is it. It's going to happen. Um, so, all dates of service. Any patient that is seen on or after October 1st of this year the claim will need to be submitted with a valid ICD-10 code. And by valid, I mean it needs to be coded to the full specificity. It could be anywhere from 3 to 7 characters. It's always going to start with an alpha. The next two are usually numbers, and then from then, who knows. Most of these should be built into your EMRs already, and they should be showing you if they are valid or not. This will not affect our CPT coding. You will still put your right-left modifiers on there like you always did. It's not really affecting your charges at this point at all. So, another thing to know that ICD-9 might still get used some. Because ICD-10 is a requirement of HIPAA, workers' compensation, third-party liability insurance is kind of like our auto insurance claims. They're not considered health plans, so they don't fall under HIPAA, so they're not required to transition to ICD-10. There are some states, I want to say around 20, that are requiring that the third party and the workers' compensation plan switch to ICD-10. I know Texas is one of them, which is where we're at right now, but they're not all doing that. I am including a link at the very end of this to a website where you can download a spreadsheet, and it will show you exactly which states are requiring and which states are not going to require the switch. So that being said, you have to kind of check with your individual workers' compensation carriers and your auto insurance carriers to see what they're going to want, and it may just be a trial and error sort of thing. Okay, there we go. Some of you may have seen or received this letter in July. CMS and the American Medical Association came out and made a joint announcement basically saying that, okay, this is really happening. It's time to get ready. And what they mentioned was kind of like a 12-month grace period. They sent out letters saying that they're not going to deny the Part B claims based solely on the specificity of the ICD-10 code as long as it's in the correct family. Now, what does this actually mean? Not a whole lot. It's not really a grace period like you would typically think of. ICD-10 will still be implemented. You will still have to put a valid ICD-10 code on the claim. This will basically apply to post-payment reviews only. They'll still deny it the first time off if it's not going to meet the diagnosis that is specified in the NCD or the LCD. And also, they will still be, we are still expecting them to deny for laterality, especially if there's a code, whether you have a left or a right or a bilateral option, if you just click unspecified, because we still have unspecified codes for everything you can think of. We just really don't want to use those in cases where we know the information. But basically what they have said was on the post-payment review, they will not be denying it if you have the right code family. And what they did was they waited a little bit to define the code family. So what they're saying now, what CMS has come out and clarified, was that a code family is the same 3-digit category. So you have to be sure you've still got to get pretty close. It may not have to be exactly correct, but you've still got to be pretty close. And then you also have to assume that they will be evaluating this information for quality measures. So my advice is do it right from the beginning. That way, hopefully, it won't be an issue later on. So the thing to kind of know about ICD-10, it's not really a whole lot different than ICD-9. Most of the processes are still the same. Most of the guidelines are still the same. There's a few changes, but not a whole lot. It's not just a real big deal. It basically comes down to good clinical documentation. And I kind of wanted to go over a few of the documentation concepts that kind of apply here. There's actually way more than this, but these are kind of the ones that apply for urgent care most of the time. Type, temporal factors, caused by, contributing factors, location or laterality, that's a real big thing. Severity, episode of care. All of this is information that's probably already in your medical record. It's just a matter of pulling it into that diagnosis. So for type, that could be, do they have type 1 or type 2 diabetes? If the record doesn't say, it's going to default to type 2 just like it always has, but you do have that opportunity to specify now. What type of hyperlipidemia do they have? That's the sort of thing they mean by type. Temporal factors, is it acute? Is it chronic? Is it recurrent? Is it acute recurrent? A lot of the codes have this built in there, especially a lot of the ENT codes, ear infections, that sort of thing, and a lot of the respiratory infections have the same, is it acute, is it chronic, is it acute recurrent? So there's still a caused by or due to. It could be an allergy, it could be a trauma, it really could be anything. If it's caused by another disease process, there's a lot of combination codes that you can pick there. Location laterality, that's a big thing. Left, right shows up in almost everything that you can think of that there is a left and a right. You can almost guarantee there's going to be a left and a right code. Proximal and distal, that's a big issue, especially when you start talking about fractures. There are major changes to the orthopedic codes. They want to know which bone was fractured, which part of the bone was fractured. Was it an open or closed fracture? Was it displaced, non-displaced? All sorts of information. Severity, mild, moderate, severe. They're making a big change in the asthma section this time for that. So it's going to be mild, persistent, moderate, severe, that sort of thing. Intractable, non-intractable for migraines. That's not a new concept. That was there in ICD-9. It's still continuing on through ICD-10. Episode of care. This is a big issue for injuries. We have the initial encounter, subsequent encounter, and the sequela. The initial encounter you can also kind of think of as active treatment, because you're going to put that seventh character is an A. You'll put that on the first time they come to the urgent care for an injury. And then if they have to go see a surgeon, the surgeon's going to use the same initial encounter because they're still treating that, whatever it is, fracture or whatever. So a few examples. The patient has sinusitis. They want to know location. Is it maxillary? Is it frontal? And there is still an unspecified option. So but most of the time this is clinical information that will be in the chart. And this is an example of when you have acute recurrent, and you have chronic. They really want to know what it is and how often it happens. Another common one we see here in urgent care, a kid comes in with a sprained ankle. They want to know, was it the left ankle or the right ankle? Hopefully this information is in your chart, because obviously our providers, they know if it was the left, they know if it was the right, which ligament is actually sprained. You may or may not know that. And there is still a code, like I have an example here for an unspecified. Is it an initial treatment or is it follow-up? And as an example of this, I've got ICD-10 code S93.401A, which is a sprain of an unspecified ligament of the right ankle, and this would be for the initial encounter. And then let's say they come in 2 weeks later and just for a recheck or maybe a re-x-ray, then you would put on this S93.401D, sprain of unspecified ligament of right ankle, subsequent encounter. So it kind of alerts the payer that it's the same injury. This is a follow-up. And it will follow along with the patient. Another one, if a patient comes in, they've cut their hand, cooking dinner one night. Same thing. Is it the left or the right hand? Is it a new concept for ICD-10? Was it a laceration? Is it just a puncture wound? Were they, bitten by some sort of insect and it's actually an open wound? Before in IC9, it all just said open wound and there was no way to differentiate. Now we have the ability to say, yes, it was a laceration. Was there a foreign body in there? Yes or no. Same thing here, initial, subsequent encounter, or sequela. A sequela would be more like if they come in, 3 months later, the initial injury is already healed, but they're still having pain from the scar or something like that. They technically don't have a laceration anymore, but they are still having issues from it. So that's when you would use that sequela code. If you notice, all those are in that 7th character place. That's the letter on the end of it. Let's see, moving on. Otitis media, we see a lot of this. Same thing here, right, left, bilateral. This is one of the cases, these ENT codes, where there is a bilateral option. That's not the case all the way through the book. But this is one of those cases where I would definitely specify. The payers are going to want to know that. And you really can't blame them for wanting to know this information. If I was receiving a bill for something, I would want to know. Is it acute? Is it chronic? Is it recurrent? This is good information, especially when you have kids who come in and, they're here, every other month with an ear infection and it's constantly happening. And this is something their insurance company will track. And if it comes time that they need to go see a specialist, then you've got that medical necessity support behind it also. What type of infection is it? Serous, allergic? Did their eardrum rupture? You have the opportunity. And that it was a concept that was present in ICD-9, but it still applies. So the code for this one, H66.003. And you'll notice this code only has 6 characters. There's not really a need for a 7th character. And this is still a valid code. It's coded to its full specificity. Acute suppurative otitis media without spontaneous rupture of eardrum, bilateral. But most of this information, like I said, should already be in your medical record. This is already stuff that your providers, they're asking these questions already. They know the information. It's just a matter of taking, just a little bit longer when you're selecting your diagnosis to making sure that all this information is on there. Okay, fractures. Let's talk about fractures. Like I said, the orthopedic section of ICD-10 is just expanded enormously in ICD-10. This is one of the biggest things. So, a few things that they're going to want to know. Is it a pathologic fracture or is it a traumatic fracture? Most of the time, in our cases, it's going to be traumatic, but not always. Right, left, always going to be a thing. Displaced or non-displaced. This should be, this should be information. You're seeing that on the x-ray. It should be in your chart somewhere. And this is one of the changes for ICD-10. And kind of what seems a little backwards, at least to me. If you do not specify whether the fracture was displaced or non-displaced, it is going to default to displaced, which is kind of just seems a little backwards to me, but that is how it is. That's in the guidelines. They want to know exactly which bone was fractured. And is it the, proximal, is it the distal, is it the shaft? They want to know, same thing here, initial, subsequent, is it open, was it an open fracture, was it a closed fracture? You have the opportunity for an open fracture to specify what Gustio rating it is. And most of that's really going to apply more for a specialist, obviously, but still, if you have a patient coming in and it's a subsequent encounter, you redo the x-ray. Is it healing well, just regular healing? Is it delayed? Is there a non-union or malunion? You have the opportunity to specify that. All of this just in that single code. So the example I have here is S92.351D, displaced fracture of fifth metatarsal bone, right foot, subsequent encounter with routine healing. So these will be fun. And also one thing to keep in mind, especially on your injury codes, I should have put an example of this. They're going to kind of want to know why it happened. In the same way that for ICD-9, we have our E codes. And not all payers require them, but a lot more of them are beginning to. We have the same opportunity in ICD-10. They just don't start with an E anymore to say, this was a fall down the stairs or whatever. And one interesting concept is that seventh character for that initial or subsequent encounter applies to your accident code as well. So where do we start at? As far as getting ready, one thing I would do, I would print off a report from your billing software. What's your top 10 diagnosis codes, your ICD-9 codes that you're using right now? I would pull some charts, start looking at those and go, okay, does our documentation support assigning an ICD-10 code? If not, what kind of information am I missing? What do I need to start looking for? What can I talk to my providers about? That sort of thing. Just make sure you're getting ready to do this. Check with any of your software vendors, your clearinghouses, your billing services, and go, hey, do you know this is coming? Are you ready? I imagine at this point most of the major ones are, but it never hurts to ask. Another thing to think about is any paper forms that you have floating around your office that have any sort of diagnosis codes. If you're still using kind of like a super bill or a charge sheet where you just have like a list of ICD-9 codes, you're going to want to update all those. This is one of those cases that there's so many more diagnosis codes in ICD-10, it may not be practical anymore to keep using forms with them already printed on there. And then you want to start thinking about training your staff, not just your billing staff, although they definitely need training, your front desk staff. They need to know that, one, this is changing, and two, it's possible that this could affect some people's insurance benefits now, whereas it never did before. I'm not really anticipating that being an issue in the beginning, but the further we go on, I think that they're going to start, there's stuff that they would normally pay for that now they're going to say, oh, I don't know if this is medically necessary, or I don't know that we really cover this anymore, that sort of thing. So you've got the opportunity there to train your front desk staff and to possibly alert your patients that, we are going through some major changes right now. It may not go as smoothly as we hope for. If you have any problems or your insurance does crazy things, just know that we are working on it and we'll contact you if we need more information. And then also your nursing staff or your clinical staff, anyone who does pre-authorizations, especially for data service that's going to happen after October 1st, they're going to have to do a pre-authorization with an ICD-10 code. So they need to recognize, one, what those look like. How do I know if it's a valid code? That sort of thing. And just be prepared Also, I've included some links here. I'm sorry, I think I went a little fast. CMS on their, let's get back. On their Road to 10 website, it really has some excellent resources. They have, especially for small to mid-sized practices, they have a lot of training. They have a lot of crosswalks available for you to look at. They have some specialty guides. There's an internal medicine one, I believe, that I looked at that has a lot of the same codes that we typically use in urgent care. And they'll show you, this is what the ICD-9 code is. This is what the ICD-10 code looks like. These are the kind of things you're going to want to think about. So that's kind of a good, it's kind of a good place to start. There's some really excellent resources on that. I've actually been very impressed with the way they've put that together, especially for a government agency. Sometimes they're a little clunky, but I think they've really done a good job on this. Also, the link I was telling you about with the state workers' compensation readiness list, that is the work group for electronic data interchange, WEDI. They do, they're one of the big, they're kind of like a think tank, and they do a lot of consulting or with Medicare or with CMS. So it's actually a very good resource there. If you click that link, there's a place to click and get like an Excel spreadsheet, and it will show you state by state who's ready, who's not ready. Is it a law? Are they just recommending it? And there are some states that are going to require ICD-10 changes for inpatient claims, but not for outpatient claims. Not many, but there's a few. So it would help, it's helpful to look on there and say, okay, yes, my state hasn't made a decision one way or the other, hasn't done anything on this, so I'm going to need to find out from my workers' compensation carriers, are they switching? Are they not switching? I imagine that most of the bigger ones will. We may have a problem with some of the smaller insurance companies. And another thing to find out from your EMR or your vendor is, will you be able to pick either an ICD-9 code or an ICD-10 code? Because you're going to have that ability to switch between the two for these reasons. And then finally, the Medicare Learning Network has excellent information on all sorts of things related to Medicare. You can actually sign up for their listserv, and they'll send you an email once a week and just say, hey, this is what's going on, this is what we're looking at. You'll get links to the national provider calls. They recently did one on ICD-10, getting ready for the transition, and I imagine they'll do some more. And there's also supposed to be some web-based training on there for ICD-10. You can also find links for a download of the entire code set. If you don't have a book or don't want to go actually buy a book, you can actually download that information. I haven't looked at it myself, so I don't know what format it's in. And then let's see. And then they have links to the GEMS files, and that's kind of the conversion where you can kind of see where an ICD-9 translates to an ICD-10 code. A lot of times they are going to be one-on-one matches. You have one ICD-9 code, you get one ICD-10 code, and you're done. And sometimes you'll have one ICD-9 code, and it may have 20 ICD-10 codes. But you can see how that's all mapped out. Another thing you can do, there are some free code translators online. I did not include one here, but that is a possibility. You can always Google free ICD-10 code translator, and you should have the ability to just type in an ICD-9 code, and it will tell you what the ICD-10 options are.
It's handy.
Okay, so that's what I've got right now. If anybody has any questions, you can type them on the chat, and I will do my best to answer.
And I know someone already typed a question, will a copy of this presentation be available for download? And yes, we are recording it, so we'll send out a replay, of course, to everyone on this call, so you have that, so you can share with your team if you want to, or you can go back and take some more rigorous notes if you joined late. We will be sending this back out, so yes, and I'll include those links that were just on the, let's see, the resources page. I'll include those links so you have those as well. So all this, yes, to answer that question, will definitely be available for replay, and again to share with your team. So, are there any other questions, or is there anything else you want to add? As far was there anything covered that we didn't quite get to that somebody wanted to kind of touch on? Let's see. All right.
So I know everybody's super excited about this transition, and everything's going to go smoothly, right?
Right.
Yeah.
And of course, I don't know if you've seen in our correspondence with Urgent Care Success, now Medical Practice Success, we are having a medical billing conference. And this is taking place in Salt Lake City, October 23rd through 24th. And so it's coming up soon. We're going to cover, credentialing, coding, all things billing and more. So if you want more information on that, you can go to medicalbillingconference.com. And right now you can take 10% off of that. I believe the regular ticket price is $599.97 is your attendance fee. So you can save 10% now. If you're interested in coming, just use that code MBCW1 at checkout. And you can check out then. Okay, so we had another question come in. It is, where do you recommend to purchase the book at an affordable price?
Oh, wow. There's lots of different places you can buy books. Let's see. One of the most common ones that we usually use is Optum, used to be in Genix. We've gotten code books from there quite often. You can go online and look for those. The member thing. Oh, okay. If you or your coders or any of your billing staff is a member of a professional organization, I know the American Academy of Professional Coders, the AAPC, has books on their website. And actually, that's what we ordered this year. This was a great. They were actually at a great price. So there's lots of different places. I believe you can actually just buy them on Amazon. It's definitely, I would check it out and see what you can get for sure. If I was actually coding from, I like to have books. I'm old school like that. I like to be able to look through the book and make sure that what I'm putting on there is the correct code and that it's completely valid. So I highly recommend a book, but I know there's some people who don't. They just use encoders or they just use their EMR, and that's fine.
Yeah. Okay, and James here wrote, thank you, James. He writes, will the conference have software available? We will. Candace, if you want to.
Which type of software? I don't know if you can type that and
ask. James, what kind of software were you, if you could specify? Software vendors? Yes, we do.
There will be some EMR vendors there available. This conference, we're going to touch and kind of go old school, as Kelly says, on credentialing, contracting, and then just basic duties of a biller and what she should be looking for, what she should be doing every day in order to kind of fill in the holes, catch some of the things that fall through the cracks, and just make sure what she's doing on a daily basis is correct. We'll also be going over what you should be doing at month end, what you should be providing to your doctors, or if you're a billing company, you should be providing to your clinics and managers there on a monthly basis. And Kelly will also be there for coding, and we'll already be into ICD-10, so she will be there to kind of walk you through some of the crutches and things that are going on. Now, we're going to have the same struggle, so we'll just do it together. But that's what the conference is going to touch on. It's going to be very informative, very hands-on. I suggest managers, billers, people in charge come, and we're going to walk you through some things and get you kind of organized and get your flow going as it should.
Very cool. Thank you, Candace. And Candace will be there too. We'll actually all be there. So you'll have this lovely bunch. And in the meantime, if you have any questions at all, please hit me. It comes straight to me. Again, this is Molly. And you can send me an email at info. I'm going to type this in the chat box. I also included the link in the chat box to the billing conference where you can get more details on that. But you can get in touch with me at info@urgentcaresuccess.com. And we're now, of course, Medical Practice Success. So we're in the works of moving some things over. So you'll see Urgent Care Success on some things and Medical Practice Success on some things. We're all in the same. So again, just shoot me an email if you have any questions at all. And thank you all for joining us. And again, if you want to send me any questions that we didn't happen to cover, we kind of wrapped everything up pretty fast. It was maybe the quickest webinar you've ever been on, but I think we included some great material. Kelly did a great job. And here's my email, just making sure I got everything right. And there you go. So please, if you want to keep the conversation going, just shoot me an email and I'll get you the answers. And we hope to see some of you at the billing conference coming up in Salt Lake. And if there's no more questions, then we're done. We good?
All right, we're good.
Thanks, Kelly. All right, everyone. Hope you have a great day. And thanks again for joining us.